Welcome to a special video episode of Surgery 101. We're going to be having a conversation with Dr. Dinesh Palipana, who's coming to us live from Australia. It's Friday night here in Edmonton and it's Saturday morning in Australia. It's winter time here and it's summertime there. So I think Dinesh has got a much better deal of this than we have. The reason why we're making this video is because Dinesh submitted a script and has done a podcast, which isn't really like any of the other podcasts that we've got in our series. And this topic is inclusive medicine. And it's one of those things that I think we don't talk about enough. It's one of the things it's a bit uncomfortable to talk about. And I think also his story is a bit different from other people, and he's been on a different journey than most of the other people that I know in medicine. So I wanted to give you a chance just to introduce yourself, Dinesh. So tell us a bit about yourself.
Yeah, thanks so much for having me. I'm going to say, first of all, that when I was going through med school, I used to listen to Surgery 101 in the shower. Because it was, I was really trying to make the most of my time to get up to speed and study. So I am used to listening to your voice in the strangest of places. So it's really cool to be chatting with you live. But my name is Dinesh, and I currently work as a senior resident in the emergency department at the Gold Coast University Hospital in Australia. And we have the busiest ED in the country at the moment, so it's a very interesting place to work. I went through medical school and had a car accident halfway through and sustained a spinal cord injury as a result. It's a cervical spinal cord injury, and I lost the use of my fingers and everything below the chest. This happened in 2010, so nearly 11 years ago now. And I came back to med school after 4 years of being away. I finished med school and graduated in 2016. And I had a bunch of challenges after graduating with getting my internship because of the spinal cord injury. And then subsequently some bits through my working life was interesting as well because of the spinal cord injury. So I never really thought about disability before I had the accident. I never really thought about what life is for people that have various medical conditions or whatever it may be. So I really got to learn a lot of these complexities after the injury. And because of the journey that I've had, I've been really interested in what medicine looks like as a profession and the diversity within it. So that's how I came to be talking to you today.
Thank you very much for sharing your story. So tell us a bit about when you say like inclusive medicine, what do you mean? Because doesn't it suggest that medicine's not very inclusive? If we have to label it and say, hey, we need more inclusion in medicine, I think we're not particularly welcoming or inclusive. So tell us what you think that inclusive medicine means.
Yeah, I think when we look at gender in medicine, just a few decades ago, well, not too long ago actually, it was a very hard profession for women to be in. And I remember reading some textbook from a long time ago saying that women were incapable of being a doctor, and we broke through that, which is amazing. But we had that mindset back then, and it's nice to see things changing now. But it's the same for people with disabilities, and I think around the world there have been lots of different challenges for people that have different functional capabilities to participate in the medical profession. For me, I had a number of challenges, and I have the opportunity to talk to people from around the world at the moment that are trying to get into medical school, or that are going through medical school, or people that are supporting other people to go through medical school with disabilities. And it's challenging for everyone, because I think we have this idea of certain physical characteristics that someone someone practicing medicine should have. And we probably need to rethink that, because medicine is such a diverse profession within itself, and it's not a procedural profession purely. There are so many other things that you can do within it. I mean, without my hands, I'm probably not going to be a surgeon, but I function pretty well in our ED. And there are specialties like radiology and psychiatry and all these other things that have a place for people. And I think we need to start embracing that, because we need a diverse workforce, and we need to start reflecting our community. And it makes us rich and strong by having all these different perspectives in medicine. But I do think that we've been fairly exclusive up till now.
Yeah, I think you're right. I've got a colleague, and when she goes on the ward sometimes to see patients, they don't recognize her as a doctor, even though she is. You know, they say, well, you must be a nurse or you must be somebody else, but you're not a doctor because that's a man, right? Or I've had some nursing colleagues who go to see a patient on the ward, and they say, I don't want a person of color. I want a white nurse. Like, go and send me a proper nurse. And this is not historical stuff. This is quite recent. So we're still relatively intolerant of people who aren't like us. And I think actually medical school, I mean, we're doing our best, but I think medical school and medical education is kind of a process of conforming. So, you know, so in the Canadian context, you have to do some kind of pre-medical stuff, like get a degree in science or something, right? And you have to kind of do all the things that a pre-medical student would do to kind of tick all the boxes to get into medical school, because it's so hard to get in. And then once you're in the medical school, I just had a conversation with someone recently who said, what is it that I can do that will make me more attractive to get into a surgical rotation or a surgical internship or a surgical residency program? Like, literally, what are the things that I have to do to tick the boxes to get into this? And then once you're in as a medical student and as a resident, you have to behave in the right way and look the right way and say the right things in order to get a job, right? And then once you're a member of a team, you're actually in independent practice. You kind of have to, do certain things to be part of that team, and certain things that you can do and say and be aren't really acceptable. And then I guess when you get to my age and you're 50 something, you suddenly start to think, back when I was that medical student, back when I was that person who was in university, and like I started this journey when I was 18. What's left of the thing that I was back then? Because I spent so much time conforming to what I'm supposed to be, how much of me is actually left? And I think it's quite sad. There's like this little 18-year-old medical student in me sort of kind of trying to signal to get out, to say, what are the things that I didn't give away over the course of these last 30 years, So what do you think about that in terms of this medical education being a process of conforming to kind of fit into the box?
Yeah, I think we have this conversation often, don't we? That especially when we look at certain specialties, and there's a very uniform set of people that seem to end up in certain specialties with similar personalities and similar attitudes and similar approaches to life. And I think like people like to have similar people around them. But conformism is definitely a thing, and we end up trying to make things a lot more uniform than is beneficial to us. But I find it really interesting what you said about, you throughout your journey that you were conforming, and you wonder what's left. Do you think that, what is left, do you think?
Well, I think you have to keep what's yourself alive, right? through interests outside medicine, or through your family, through your friends. Because if you're just a doctor, at some point your career will end and you will retire. What are you going to be left with? And certainly I've seen this in some of my senior colleagues who retire, and you kind of say, well, what do they have to do now? I've actually had some people, you see them still coming into the hospital. Like they've been retired for a long time and they don't have any patients anymore. They're still coming in every day. So I think you have to remember that that there's something more than just your job. You know, you've got to have some interests outside this as well. I remember one of the guys, one of my mentors from way back when I was a medical student, he said, so you've always got to have in the back of your mind, what would happen if something happened to me and I couldn't operate anymore and I couldn't do this job? Like, I'm not just going to throw myself off a bridge. I've got to find something else to do with my life. So I think it's important to kind of keep your breadth of interests alive over the course of your career. Because if you're not careful, medicine could just suck every single part of you out. I mean, you could operate every single night. You could be in the hospital every single night if you let that happen to you. And I think you got to be careful about that. I mean, you know, the sad thing is the moment you retire, a couple of months later, the medical students will say, Dr. White, who was that? Never heard of him, right? Like the hospital just keeps on rolling, baby. And it just keeps running 24/7, right? So, and it doesn't love you, it doesn't own you. You got to be separate from that, I think.
Yeah, yeah, yeah. But that, and I think I have had colleagues who've been in procedural specialties, and then suddenly something happens to them where they can't do that anymore. And I think things just keep rolling, and then they get spat out. And I think that there's a hard reality sometimes that happens.
Yeah, but you find yourself to be you've got a lot of support from your colleagues, right? You've had people step up to actually say, we're not just going to drop this guy by the side of the road and put him out in the cold. We want to keep him in as part of our family almost.
Yeah, and I think I've been really fortunate enough to be in a place where I felt like that, even in medical school. When I was having these discussions about coming back to medical school, there were definitely people that had doubts about it. But by and large, a lot of the decision makers and the senior leadership thought that it was worth at least giving me a try. But I remember going around to meet all these different clinical supervisors that would have me for the year. And this was before I started back after the accident. And some of them were extremely supportive. And then there were some that were asking questions like, well, I don't know if the patients would take you seriously, and I don't know if they would, how they would see a person in a wheelchair coming up. So they had all these questions about it. But yeah, I think I was very lucky to have people that just treated me as part of the family. And I think that's important, you know, the cohesiveness, because we go through some really hard things, and we have I think medicine's a very unique career, and there are some unique challenges and things that are difficult to understand if you're outside of it. So to have a family within it really helps. And it was the same once I got to the end of medical school and needed to, was struggling to get an internship because of the spinal cord injury. But there were so many conversations, and there were so many questions, and there were so many challenges. But I had people that were passionate enough to support me. And I was telling you earlier, some of them offered to give up parts of their salary to fund my internship. So that's something pretty special. And I was lucky to have that, and that people were willing to fight for that. That is really important.
I think it's that moment when you find your colleagues are kind of standing up for you. You know, where you say, this thing that's happening isn't right, and I'm gonna take a stand and say, I don't care what the senior people think, and I don't care what the accepted wisdom is. This is wrong, and we're going to stand up against it.
Yeah, which is really important. I think us, again, in medicine, I think we have an opportunity to be an opinion leader on a lot of things that happen in our world. And we have an opportunity to have a say in things, and we have an opportunity to share our thoughts. And I think it's really important that we do fight for what is right. A couple of years ago, actually in 2015, there was a policy that came out in Australia, and it was about all medical schools applying some inherent requirements about what characteristics medical students should have. So it was all these physical characteristics, like you should have this much sensory function, this much motor function, and this and that. And if that was applied to me, I would be out of medical school. And I saw an email from one of the committee members that was writing this policy, and it said that they wanted the legal protection to exclude someone with a disability from studying medicine, or exclude someone with a disability that's already studying medicine. It was along those lines, and the email was, it was a very difficult thing for me to read. But anyway, fast forward a couple of years, I got an email from 2 medical students. This was after I graduated and I've been working. 2 medical students from a particular university. And they said, you know, we came across this policy and we think that it's just abhorrent, and we want to, what can we do to change it? And then they started talking to their academics and talking to the leadership of their medical school, and they really pushed and pushed and pushed for it to change it, because they felt that it just wasn't right. And they made a huge contribution towards that. And I think that kind of thing is really, really important. That kind of activism is really important, because the power is within the people. I feel that sometimes the establishment and the leadership might lose the picture, and it becomes about risk management and all these other things that you get bogged down in. And you may lose the sight of what's right. And it's sometimes up to the people to be activists and to change that. But it takes guts, and it takes risk, and it takes putting yourself out there.
Yeah, I must admit, I serve on a lot of different committees now, the university and the health system and different things. And it's funny, you have this discussion and it gets to a certain point and there's this silence in the room. And then somebody, often it's me, but often it's some other people, that somebody says, wait a minute, but if you say this and then this and then this, then that means that, right? And that's a bad thing. And then everybody says, yeah, you know, you're right. We go around the table and it turns out everybody is thinking, oh, this is really bad. But we were about to like approve the policy and nobody was willing to say anything. So it just takes one person to step up and say, wait a second, because I think that might be a problem. And then suddenly you actually get to hear from people around the table who are all thinking the same thing. And the number of times I've been on committees and, you know, we take a break and we walk out of the room and somebody comes up to me and says, I was thinking exactly the same thing, but I just wasn't willing to say it because I didn't want to like irritate people. You know, you got to be willing to be the first person to stand up and say, this is wrong. Look, this is just wrong. Like, maybe I'm missing something here, but if you do these things, then this bad thing will happen. And the idea that you can set a list of criteria to describe what a medical student should or shouldn't be, to me, that sounds like you're lacking some imagination there. Like, really? There isn't anybody who can do this job outside your limited criteria. What should the minimum are we talking about like height criteria? We shouldn't have any doctors who are less than 5 feet in height. Like, what are you talking about? It doesn't make any sense.
Yeah, and I think a lot of things in medicine it's based in tradition, like the way we do things, perhaps the way we examine a patient, the way we go about it. It may not necessarily be evidence-based or the most efficient, but it's just traditionally the way we've done things. And I've seen a different approach from another institution where they've looked at the outcomes. So it says that, you know, the medical student should be able to elicit this particular sign or physical examination finding. And they just have to demonstrate some means of doing so, which I think is a lot more sensible because it gives you an outcome rather than the means.
Yeah.
It's an outcomes-based thing. So that's another way to look at it, which may be more efficient because we have so much technology as well to do things. And I use things like voice recognition and all sorts of other tools to make practice easier. So I think, yeah, like you said, it's a lack of imagination.
Well, and also there's a certain lack of humility there, where you're setting yourself up as the arbiter to say, well, this is what medical students or this is what practitioners must do. I think when the gods hear you say, and at least in surgical practice, I find this, when we're quite superstitious, when the gods hear you say never in a sentence, they say, whoa, he just said never. Let me hold my beer for a second. I want to go and prove him wrong. Right? Oh, I would never do this. And then it turns out, well, here's a situation where you would. So I would say if you say a medical student should never be like this, that, or the other, I would say hold my beer, because I can probably find somebody who's an awesome doctor who doesn't fit your limited criteria for what that actually is. Like expand your mind a bit, because there's the field of medicine and the people who are in it are much broader than your little box is saying, you know.
Yeah, I think also there's the British Medical Association did a bit of work around inclusivity, and I read a quote from Sir Bert Massey, who was an inclusivity advocate, in one of those documents, and he said that the medical profession should reflect the community that we serve. And I think that's important because even in the pandemic, there was a lot of things that people with disability began to experience, some of the problems that were amplified, and they included things like healthcare rationing. For example, in Europe, one of the countries had these guidelines where people with disabilities had, you could rationalize giving them less access to intensive care and refer them to palliative care instead of ventilating them if they were affected by COVID-19, which is a pretty big thing. But you need people within medicine with disabilities or chronic conditions to advocate for this stuff. Otherwise, we just end up being very paternalistic and making these decisions. So we need people within medicine to see these things and critically examine these things and to be a voice for our diverse community. So I think that's really important as well. Yeah.
Well, certainly. I mean, if I think we've established that we've kind of structured medicine to select people that are like us because we're comfortable with people who are like us, right? Who think like us and who look like us and who behave like us. And patients are kind of that way as well. Like if you're I saw a lady today who is a person of color, a female, and doesn't speak English. And yet here's this middle-aged white guy who's coming in to take history from her, right? I mean, it's very difficult to bridge that cultural divide. So we need like patients should be seeing themselves reflected in the medical workforce. They shouldn't just be all middle-aged white guys who are the doctors, obviously, right? And I think COVID is very interesting because it's almost like COVID was it's like a Greek tragedy. COVID has come and has mercilessly exposed the flaws in our society. Like prior to March, we had this society that seemed to be running okay, as long as you were on the top and you were doing okay, right? And COVID basically came in and hit us at every single weak point we have, right? I mean, it has increased inequality. Like the people who were doing well before are doing better. The people who were at the bottom of the socioeconomic ladder are really struggling. And it started to make me think like this world that we thought we lived in and we thought it was okay, it really wasn't very nice under the surface. When you lift the lid off the barrel, it's all full of worms, right? It's not very nice. And really the question for me with COVID is, People want to go back to normal, right? I'm not sure that I really want to go back to the way it was, because now you've seen some of the worms. You need to fix that, you know.
Yeah, but I think we've got to see the opportunity, and we will probably be a better world hopefully afterwards. But having said that, it costs us a lot of lives, and we probably saw some very difficult things, but hopefully we'll leave this a better world. I also think that it's interesting what you talked about patients. Sometimes I wonder if patients even realize that I'm in a wheelchair, because it never comes up. But I'm going into the 5th year as a doctor now, and probably come across thousands of patients. And I have to say that not a single one has been untoward or felt funny about me using a wheelchair. Not one, which surprises even me, because I thought at least one of these patients must think, wait a sec, how can this guy be a doctor in a wheelchair? But not one. And they've all been amazing, and they've all said positive things. And maybe someone might have thought something in their head, but honestly, like every single one of my interactions with a patient have been positive, which is a really surprising thing.
Well, presumably that's because you're a good doctor, right? Like you walk into the room, you come into the room and you make a connection with the patient, right? And that's what they value. And the fact that you're in a wheelchair is kind of irrelevant to them, you know.
Yeah, I hope so. But I also, when I had the car accident, just a couple of weeks or a few weeks before I had the car accident, I can't remember when, I got this lecture from an emergency physician who is the director of the state's ambulance service now. So he was showing us all these photos of traumas that he attended to and the kind of work that he did. And I was a second-year medical student then. I thought, oh my God, this is amazing. I want to do what this guy's doing. And I remember that lecture so clearly for that reason. And then I had the accident. And that night when I was in the ambulance, I look up and it was him in the ambulance. I was like, whoa, you gave me a lecture. This is awesome. But you know, the thing that I've taken away 11 years down the track now, I'm sitting here talking to you who is across the world about him. And that's a pretty amazing thing, because the thing that he left me with the most is that in the ambulance that day, I knew that, he's a doctor, so I knew that he had the skills and the necessary technical ability to make sure that I was safe and whatever else. But what I remember is the way he made me feel, the way he talked to me, and the way he handled me as a human being. And I still remember that 11 years down the track, and I still carry that to my patients, because I don't think the technical side of what we do, it obviously matters, because that's what we do to help our patients. I think what's most important is how you make a person feel while you're doing that. And then that's what he taught that night. And that's what I carry through with me to this day, is how you make a person feel is really important.
Yeah. Well, and I think you'll have a particular perspective on this problem that I've come across before, which is called us and them, right? So us is the medical profession, right? And we're the doctors, and we treat people, and we treat these patients of ours, right? And we do things to them or with them sometimes, and they get better or they die, right? And them are the patients, and they're the people with the problem, and we try to help them, right? But you'll notice we are not the ones with the problem. They're the ones with the problem. And we're totally separate, right? And unfortunately, what your story illustrates is there's no such thing as us and them. There's just us, right? Like one minute you're a doctor, the next minute you're a patient. And when you're on the patient side of the equation, that's a very different place to be. And it sounds like the guy who you're talking about in the ambulance, he's a good doctor because he made you feel important. Like he almost like held your hand and said, I'm going to get you through this, right?
Yeah.
And unfortunately, that's a pretty uncommon thing. And when I think about I have good days and bad days. We all do, right? But when I'm at my best, I'm treating people the way that I'd like my mom to be treated, or my dad to be treated, or my brother to be treated. Because everybody is somebody's mother or father or brother or sister or some connection to another person, right? So the moment that you forget about that you forget about the fact that these are actual people you're looking after with families all around them, is the moment that you're lost in this profession, I think, because you've got to remember that you should treat people the way that you really want to be treated, you know.
Yeah, and I think it's a really important thing to stay grounded in all the time, because we probably need to often remind ourselves why we're here to do this job. And I would hope that a lot of us are here because it's a fundamentally human endeavor, and we want to play a positive part in our fellow human.
Yeah.
That's hopefully the foundation of everything that we do. So
I think one of the things that distresses me sometimes is how we kind of label each other, and to the point where people are uncomfortable in being themselves sometimes inside medicine. So or we tell each other stories about each other. I remember this time we had a medical student who failed their exam, right? And we brought them back to do a rewrite. So this guy turns up and he's like 15 minutes late for the rewrite, you know. And he comes in and he looks like he hasn't washed. He's wearing yesterday's clothes, you know. And he sits down, he looks quite agitated, you know, and he's rewriting the exam. And the person who's proctoring the exam, who's looking at this happening, says, "Oh, there's another lazy medical student. You know, he's lazy, he's stupid. He couldn't even show up on time. You know, he probably didn't even wash. He just probably woke up. He's probably hungover. I don't know. And here he is rolling in to do the exam late, and he failed the exam. Right. So the guy who's proctoring that thing sits him down and says, "I wanted to talk to you about this exam because you failed it twice now, right? And you showed up late for the exam, and you know you didn't look like you were organized. So like, what's going on?" And the guy said, actually, he said, "I've just flown across the country. I had to fly all the way to the East Coast for my father's funeral. And then I flew all the way back and I got off the plane and I got here as soon as I could. And here I am to do the exam. And that's why I am disheveled and I look like I haven't slept because I've been on the plane all night, right? I haven't been home. I just came here to do the exam." And in fact, the medical student wasn't stupid or lazy or anything like that. He certainly wasn't hungover. It was just that he'd been through this major personal trauma. But for me, the most distressing part of that story is the student didn't feel they could disclose that to anybody. Like if they were to disclose that, it would be some sign of weakness, you know. And the guy who was proctoring the exam said, "If you had just said that, if you just emailed me and said, look, my father died yesterday or whatever, then we wouldn't have done the exam today." But the culture that we have in medicine says that you never ask for help. Like asking for help is a sign of weakness. So I mean, you're somebody who's been through that yourself in terms of having to ask for help, being forced to ask for help. So what are your thoughts on that? How can we encourage people to actually ask for help when they need it?
yeah, I think one of the things about me is that my condition is very visible. So there's a wheelchair, there's certain physical things that are challenging. And sometimes I guess people don't realize that I can't use my fingers, but everything is largely visible, and therefore it ticks something off in people's heads that, okay, maybe we need to think slightly different about this situation. But I think it's that there are, we've been doing some work around trying to figure out how many doctors there are with various disabilities or problems, not problems, but challenges. And that figure is really hard to ascertain because a lot of people don't want to disclose it. They don't want to disclose that they have a medical condition. They don't want to disclose that they have anything. So that number is really hard to ascertain. There are a lot of people just struggling with these hidden challenges, and it makes their life difficult. And then this year in particular, we've seen a bunch of our colleagues end their lives, which is just tragic. We've had so many, particularly junior colleagues, going through some difficult times, and we've just lost too many. So I think, I think medicine's really interesting because we do things for our patients and we try to look after them, but we don't look after each other very well at all. In fact, I think when someone makes a mistake in medicine, we're very judgmental and we punish them for it and we talk about it. So we just don't care for each other much, but I think it's really up to us to just start looking after each other a bit, just asking each other whether we're okay, asking each other how we can help, even just taking a load from one another just to help them get through a day or whatever. I think that's really important because our cohesion is our strength. Even workloads, like when someone's going through a hard day or when someone's going through a hard period, I've often heard, oh, geez, they're increasing the workload for everyone else. Or, they're going through. I actually had this conversation with a surgeon once. And this surgeon, their department was an all-male department. And he had he had this very open and honest chat with me. And he said, oh, we have an opening for another surgeon now. And it's probably time that we have a female surgeon in the department. And I think that we are equipped enough to take the load to manage their needs. Because, females have, they generally tend to care more for their families and they'll probably want to go look after kids and things. So we are well equipped to take that load for them. And I sat there and like, wow, it's fascinating to be hearing this. And this is an honest conversation that I heard one day. So it's the kind of thinking that's there. But I just think a lot of these attitudes probably need to be rethought. And there's probably the next generation that needs to think differently. But I guess the thing is the seniors shape what the next generation thinks. And if we keep whipping them into another generation of the same, it's probably not going to be good.
There's a friend of mine who says that the dinosaurs are dying, but they're laying a lot of eggs, right? And I remember I was operating in one room, and the trauma room was going the next room over, and they got some poor patient in who'd been involved in some horrible accident. I think he was hit by a train or something, right, and had multiple injuries. And they brought him into the operating room and they tried to save his life, and he died on the table. And it was a very traumatic experience for everything. So about half an hour after they finished, my chief resident wandered in. This is several years ago. Chief resident wandered into the room, and I said, "What are you doing?" He said, "Oh, I'm just hanging out, And the nurses actually said, "So we're doing a debrief in the trauma room, like everybody who was in the trauma room. Now the patient is gone. We want to just give everybody a chance to talk about what was happening. Do you want to come in? Be part of the team and talk about what happened, this terrible thing where the patient died on the table." And he said, "Nah, I'm okay." And I said, "Get your ass in the room. Like, you are not okay. Like, this poor person came in and you tried to save their life and there was blood everywhere and clamps and everything, right? And the guy died on the table. That's like the patient. I probably had 4 or 5 people, maybe over the last quarter of a century, die on the table in various settings. And I remember every single one. Like, I can tell you exactly what I was doing and what the problem was. Like, that's a major event. And if you don't recognize you need to stop and process that and seek support from your colleagues, that's a big, big deal. And for anybody who's listening, who's struggling with anything, I would remind you, and I would try to convince you, you are not on your own. Everybody's struggling with something. Everybody's got weaknesses. Everybody's got things they're not happy with. Everybody's got stuff that haunts them or struggle, or they struggle with. So if you think you're on your own, you are not. And that's why we need to be good colleagues to each other and actually support each other and be kind of a sounding board for each other. I know I've got several colleagues that I talk to, and they talk to me sometimes as well. And we have really honest conversations behind the scenes sometimes about the things that we're struggling with, and we do try to help each other. Um, and especially with COVID at the moment, we're actually saying, well, we're all a bit afraid of COVID. So we want to spend as little time in the hospital as possible. So we're all kind of rounding for each other to make sure that, that people can stay home and be home with their families instead of having to come to the hospital every single day. So, and it's getting us away from this idea that there's a single way of being a doctor, and that single way never has a problem or never struggles or never worries about anything, because everybody's struggling and everybody's worried about something.
And I do think we need to really proactively be there for each other and to support your colleagues and support your juniors and even support like your seniors wherever you can. When COVID happened, one of the senior doctors in our hospital got in touch with me and they said, I know that you have some unique needs, like if one of your if someone close to you gets struck down by COVID, it leaves you in a difficult situation because you don't have anyone to help you. So let us know and we'll arrange things to make sure that you're okay.
Yeah.
I've seen some of our senior staff and even junior staff do some really nice things for each other. And I think that is so important to feel supported, because it is a really unique profession with unique challenges and unique pressures and unique emotional trauma, like the one you said, the story you just said, and we understand each other. And I think we need to support each other through that.
Yeah, and I think you're right about making it overt and actually normalizing it. I mean, you shouldn't have to wait until you're in a wheelchair until you ask for help, right? You shouldn't wait until like parts of your body are missing until you finally ask for help. It's like Monty Python and the Holy Grail, right? The knight who gets all his limbs chopped off. It's just a flesh wound. It's just a flesh wound. I mean, we should say that this is a difficult profession that we're in. Sometimes it has negative effects on us, and it should be normal to ask for help. If you're in the military, it's totally normal to ask for help. It's totally normal to say, I was in this difficult situation. I had this traumatic effect on me. I need some assistance with this, right? But somehow in medicine, that seems to be kind of like something you're not allowed to talk about, and we should try to change that.
Yeah, I agree, and I think we are losing too many to suicide.
Yeah.
We need to. It's probably the right time for us to take a deep look at ourselves and think about what we want to be as a profession in the next 10, 20, 30 years.
Exactly. So I've got one more kind of quick question for you before we finish, which is medical students and residents, they probably feel like they're the bottom of the barrel, right? Because this is the hierarchical system, right? You've got the big professor of surgery or the big consultant surgeons at the top, who are typically like middle-aged white guys like me. And then you've got these kind of, much younger, more junior medical students and residents who are not in positions of authority yet, but they're going to be at some point in the future, right? They're coming up. So how do we, if you're a medical student who's having trouble speaking up or standing up, who's seeing something that's wrong, what's your advice to them to kind of challenge that sense of tradition and hierarchy? Because the most dangerous thing, I think, is the junior learner who sees something wrong and doesn't say anything. So how do we what's your advice to medical students who are having trouble standing up?
And it happens all the time. It happens all the time. We see this all the time. And there's such a big power differential because a lot of the seniors, or at least they're perceived to control where your career goes and they're perceived to control what happens to your future. But you know what? Like, I think there's, again, there's a huge amount of power among the collective. there's often just one person trying to exert power over 10, 20, 50, 100 people. But those 100 people have an incredible amount of power for, to actually create change. And it is important to, it's scary and it's risky, but it is important to speak up, because that's the only way things change. We see so much bullying and sexual harassment and all this stuff, but action can't be taken because everyone's too scared to speak up. So nothing's going to change. But if we take the time to speak up, if we build up the courage to do that, then things will start to change. I guess the other thing to remember is that I think, to add to that point, I think it's important to find allies, senior allies that you can trust, and that you can divulge things to, and they will go to fight for you. And there'll always be people like that. There'll always be people that you can trust within the system, that you can go to, and that will help you navigate these situations. So don't keep it to yourself. But it's also important to remember it's great to learn from mentors about what you want to be like when you are a senior yourself, but it's also important to learn about what you don't want to be like. And I think you've just got to remember, hopefully you don't want to be that person that is the bully, that tries to exert power and that tries to overpower people. And so it's important to remember what not to be like as well.
Yeah, I've certainly had like negative role models in my career where I'm quite grateful actually, because I've got this person I'm thinking of right now. And I'm like, I've got like 20 different things I don't want to be, because you're all those things, like you showed me how not to be. Like if I can be the opposite of you, then I might be a good doctor, And I think actually it's interesting. I've had medical students come to me over the years with various issues and bad things that have happened to them, and the first part of the conversation is like, this is totally confidential. Like I will take those stories to my grave. I'm never telling anybody what you're going to tell me, unless you actually want to. And then we talk about what happened, and then I say, well, like, tell me what you want to do next. Is this just a conversation you want to have and I take it away and we never talk about it again? Or do you want me to go to the person and tell them that this happened and it was a problem? Or did you want me to go with you to the person and we can talk to them together? Or did you want to like make a formal complaint? Or like, what are there's a ladder of different things you can do here, and you're driving the bus, you can decide what it is you want to do. Almost everybody says, I don't want to talk to the person and I don't want to make it a formal thing, right? I don't want it on my record, whatever my record is. Like there's a record somewhere, there isn't a record, but anyway. But almost everybody says the same thing, which is, I want you to talk to this person and let them know that they hurt me. And let them know that I noticed and it was sore, and I don't want to talk to them, but I want to make sure they don't do it again to anybody else, right? And I think if we can do that, if we can actually get students to come up and bring what happened so that we can address it in some way, it means maybe you're the last person that happens to. Because I've been involved with a few things over the years where a bad thing happens and you look back at the history and it turns out this person's been doing these bad things, harassing somebody or bullying somebody, and they've been doing it for a long time, and nobody had the courage to stand up and tell us that it was happening. So I mean, my advice to medical students is, if it's bad and you're not happy with it, tell us about it. At least then we can do something about it, perhaps. You're still driving the bus and it's still confidential, so you get to decide what it is that happens. But if you don't tell us it's happening, it's very hard for us to fix it.
Yeah, I agree. And I think that's one of the biggest challenges that we face in medicine, is bringing about change, because there is a lot of understandable fear about speaking up.
So I guess that's about the end of our time together. It's been a real pleasure talking to you, Dinesh.
Thank you so much. It's great to chat to you and finally see you as well.
And it's been, I'd like to thank you for taking the time to talk about some of these more difficult issues, because sometimes they're the things that people aren't comfortable with and they're not happy talking about. So it's really great to have a chance to exchange some of our ideas. We could probably talk for longer,
Yeah, no, thank you. It was really good to hear some of your experiences and learn from that as well.
Well, thank you very much, and have a nice. Is it afternoon yet or still morning?
Yeah, it's 18 past midday. So
Well, have a nice afternoon. Thank you very much.
thank you. Have a good night.